Are you a male? Do you have issues urinating? Do you have pain in your pelvic or genital regions? If there's a problem down under, it's best to get checked out before your reproductive organs plunder. Did you actually know you're at risk for BPH, prostatitis, testicular cancer, and prostate cancer?
Yeah, no, that would happen to me.
BPH, prostatitis, testicular, and prostate cancer are no joke. If you don't pay attention to these symptoms, your reproductive health could croak.
Okay, you keep saying all these big words, but what do they really mean? How can I impact my reproductive health?
I'm really glad you asked. Let me tell you about them.
Hi everyone, today I'm going to be talking about benign prostatic hyperplasia, BPH for short. And if you can see by in this diagram, this is what a normal prostate looks like, and this is what a prostate with BPH looks like. So basically, the prostate is enlarged, but it is not malignant and it's benign. So it doesn't mean cancer or anything. And this does not have any direct effect on like the newborn or the fetus, but it can affect fertility because if this is enlarged, it reduces the size of the urethra, which would reduce like the amount of semen that flows out, or like it can also cause erectile dysfunction, so that can affect fertility later on. And on reproductive health, like I said, it affects the semen that comes out, and it can also cause a UTI, which can also like affect the penis and the whole reproductive system. And apart from BPH itself, if you're treating BPH, the treatment can also lower sex drive. It can also decrease ejaculation. It can also cause erectile dysfunction. So just not only the disease itself, but even the treatment can overall affect the male reproductive health. So for nursing assessments, you want to assess a couple of things. A lot of them also have to do with the urinary system. So if a patient comes in with BPH, they're gonna have urinary problems like difficulty urinating, pain on urination, abdominal pain. They're gonna have incontinence or retention. They most likely would have retention because of how small this passage is, so they're not gonna have a lot of space to break out urine. Even if they can void, they're not gonna be able to fully enter their bladder, which can further enlarge the bladder. You're also going to have an increase in prostate specific antigen levels, PSA, and it is going to be very hard to insert a Foley catheter in this kind of patient. For interventions, you mostly want to palpate and scan the bladder for urinary retention and for urinary distension. You want to monitor intake and output since they're going to have problems with voiding, and you also want to encourage fluid intake because you want them to pee, so you want them to take a lot of fluids. You want to train their bladders, so try to make them void every 3 hours. You want to ambulate to get them going. You also want to anything to encourage the patient to pee, so you want to turn on the faucet, anything like that. And if possible, you also want to try and insert a Foley if it's possible to help them void. And you also want to avoid giving them any anticholinergic medicine, anything that would make them retain urine. You don't want them to take it, so you want to avoid that. That is all I have about BPH.
Hi everyone, I'm going to talk about testicular cancer. So you will see right behind me, I have two pictures. One is our healthy testicles and another is a testicle with cancer. And testicle with cancer affect our reproductive system. And the first sign of testicular cancer is often you see there is a tumor in the testis, and it is the sign of testicular cancer. And testicular cancer is often a bump or a lump on the testicles. The cancer cells can grow quickly and they often spread outside the testicles and affects other parts of the body as well. So it is very important for us to prevent the testicle cancer before it becomes more difficult to cure. And it will also impact to the fetus, newborn, and fertility problem, okay? And some research has suggested that men with fertility problems such as low sperm count or low sperm mobility, it can cause changes in your testosterone levels as well as genetic damage to sperm cells, both of which make it harder to conceive. And we have some nursing interventions or nursing assessment for a testicular cancer. Some are like assessing and monitoring the patient's physical and emotional status, keeping track of their labs, pathology of their disease, and the CT scans or imaging pictures that helps us to find the progress of the disease in progress, like how much patients are going through. And some interventions like safely administering the medications, fluids in cancer treatment, such as we can also do chemotherapy, collaborating with doctors and other healthcare providers who are taking care of those patients, treatment plans like surgery, chemotherapy, and radiotherapy. And we are also doing activity to find out the testicular cancers in our class. So we will show you like how to find the testicular cancer in class. Thank you.
Hi, today I'm going to be talking about prostate cancer. It affects 1 in 9 men. It's a small gland that makes fluid that protects your semen for when you ejaculate. One of the major things that you should watch out for is frequent urination, weak urine flow, painful urination, blood in the urine. It's actually a slow cancer growth, so it doesn't really affect your reproductive system. So the only time it affects your fertility is when you seek chemotherapy or any type of treatment, and that can affect your sperm count and make your sperm low. So that will be the only way that you will not be able to conceive children. But if you do have it, you can do closely monitor and you will still be able to have children. So some of the nursing assessments that are included, so you would do a history and physical examination, and then they will also go in for a digital rectal exam, and you'll get a labs of course, and you'll do like a patient education and promotion, and then you'll monitor their urinary, their bowel, and then you'll also monitor their sexual functions. So for some interventions, you have to make sure they adhere to their routine like checkups, because since it is a slow growing cancer, it doesn't really affect your lifestyle. So you can still live a normal lifestyle, but as long as it's not rapidly growing, you usually don't have to have surgery. You of course attain your DRE, which is digital rectum examination, and then as nurses we will measure the growth of the prostate or see if there's any growth in the prostate, and also watch for obesity and nutritional needs, because that can also affect how the cancer grows.
Are you a young or middle-aged adult male? Do you frequently urinate or have difficulty urinating? Do you have pain in the pelvic area? Painful ejaculation? Fever, chills, or maybe a muscle ache? You just might have prostatitis. Prostatitis is when the prostate is inflamed due to bacterial infections. This is an issue to reproductive health because the prostate functions to lubricate sperm, which helps create semen. Prostatitis can be acute or chronic and is typically rare. However, if treatment does not occur, the sperm and semen can be permanently altered due to inflammation. Acute bacterial prostatitis occurs rapidly and has more severe symptoms, while chronic bacterial prostatitis occurs when acute prostatitis is not treated properly. Chronic bacterial prostatitis can also occur from STIs and pelvic pain syndrome. If prostatitis is left untreated, this can result in bacteremia, epididymitis, prostate abscesses, and infection that can spread. If it becomes chronic, depression, sexual dysfunction, and changes in sperm and semen can occur, which can lead to infertility. Prostatitis is diagnosed through urinalysis, blood test, prostatic specimen test, digital rectum exam, prostatitis massage, transrectal ultrasounds. Treatments are as follows: antibiotics, alpha-adrenergic blockers, NSAIDs, some pain relievers that do not require medicine such as sitz bath, stool softeners, psychotherapy, and diet changes. If you're hospitalized, you can anticipate your nurse to conduct a urine analysis, PSA test, and ask about your pain frequently. Monitor your temperature and urine, provide you with antibiotics, NSAIDs, and provide you with fluids. If during the hospitalization you cannot urinate, you may have to receive a catheter. To be sure this doesn't happen again, the nurse will educate you on the importance of safe sex and proper hygiene, importance of hydrating, importance of avoiding alcohol and caffeine as it irritates your bladder, and treat any UTIs rapidly so that it does not develop into prostatitis. Go to the doctor if you are experiencing the inability to urinate, painful or difficult urination with fever, blood in the urine, and severe discomfort or pain. Don't be shy. Go to your doctor if you think you might have a UTI.